Hey, good evening, everyone. Welcome to our webinar on varicose veins treatment. My name is Vicky and I'm your host this evening. Our expert presenter is Mr Aaron Sweeney, Consultant Vascular Surgeon. This presentation will be followed by a question and answer session. If you'd like to ask a question during or after the presentation, please do so by using the Q&A icon, which is at the bottom of your screen. This can be done with or without giving your name. Please note that the session is being recorded if you do provide your name. If you'd like to book a consultation, we'll provide contact details at the end of this session. I'll now hand over to Mr Sweeney and you'll hear from me again shortly.
Evening, everyone. Well, that's me, a slightly younger looking version, I think. But I'm a consultant vascular surgeon here at Benenden. I've been working here for the last 10 years or so. And tonight, I'm going to talk mostly about varicose veins, what's available to you, sometimes why they occur, what treatments are available to you, and what are the symptoms that varicose veins cause. I spend a great deal of time telling people that varicose veins are not just a cosmetic problem. Often people have them for many, many years, and they come and see me usually because something has happened, whether it's cramping, pain, bleeding, or skin irritation. But in this session, we'll talk a little bit about my experience. I'll give you a little idea of what varicose veins are. I'll briefly mention about the grades of varicose veins because many people are told what grade they have. And then I'll tell you what's available to you. And then we'll do a little video of somebody who's had their veins treated. And at the end, we'll do a question and answer session, which is normally the most important bit. I tend to try not to bore you too much with too much info because many people have looked online to see what varicose veins are and what treatments are available, and it can be very confusing, but they often have very, very specific questions. Sometimes you think they might be a little bit silly. I would avoid thinking that. You'd be surprised how many people would have liked to have asked the questions that you may well ask. So that's me, qualified in '92 from Dublin. You might have guessed that from my accent. It seems like an awful long time ago. I became a consultant in 2002, and before that, just before I became a consultant, myself and my colleague saw a very good doctor doing laser treatments. It was originally developed in New York. We both thought it was a fabulous treatment. And although we first did it in around about 2000, it took us until 2005 to get it finally passed as a safe procedure. It often takes many years to make sure that something is safe and effective and works well. It requires a great deal of research. I did a very small amount of that. That was mostly down to many other people who worked very hard. I perform around about 1,000 of these a year, a little less during COVID. And here at Benenden, we perform the largest number in the UK. So it's what we would call a relatively common operation, and I think a very effective one. We can mention some of the bits and pieces, but essentially the CQC thought we were pretty good. That's quite a hard rating to get. And most patients find us are happy with the treatment they get. It's difficult to get 100%, indeed 100%. When you see that figure, you have to get a little bit worried. There's always a few people who find we didn't quite meet their expectations, but I try my best to do that. So what are varicose veins? Well, people talk about valves and how a valve becomes blocked or broken. I think it's best to think of varicose veins or your veins like a Christmas tree. So you have a large artery that brings all the blood down your leg from your heart. It's supplying oxygen and stuff to your muscles, and then that blood has to get back up to your heart to be pumped again. And essentially it leaves your leg through a very large vein, which is rather like the trunk of a Christmas tree. And then there are hundreds of branches that join that deep vein. And those branches are mostly coming from muscle, and they're surrounded by muscle. So they have a bit of help in squeezing the blood up your leg. And indeed, just pootling around the house, you're draining about 1 litre a minute up your legs. So it's quite a large amount of blood. If you're doing cycling, it can be 2 or even 3 litres a minute. It's an amazing amount of blood that whizzes down and back up your leg. But if you think of the Christmas tree analogy, most of the veins are draining muscle, but some of them are actually draining the skin. And you can sometimes see those little blue lattice-like veins. And many of them are just transverse, but some of them are vertical, and they sit just under the surface of the skin. There's 2 veins in particular, one that runs down the inside of your thigh and one that comes out of the back of your knee, that are notorious for going wrong. And they have little valves because they're not surrounded by muscle. And occasionally those little valves fail, and then you get blood pouring back down again. So instead of trickling its way up your leg from your skin, you end up with a little waterfall of blood that can sometimes be quite long. Occasionally you see veins that are 40 or 50 centimeters long, just under the surface. You don't necessarily see them, but they often appear in the lower part of your leg. And sometimes people wonder why those veins are really sore. And the answer is, well, you might have 40 centimeter tube running right up to your groin that's not working. So it's rather like a yard of ale sitting under the surface. In terms of what veins cause, usually it starts with a little bit of leg swelling. That often happens when you're sitting in a seat for the day, or for driving a car, for example, or just standing. That's not particularly dangerous, but occasionally you can see a few veins popping out. Most people get some kind of discomfort, whether it's an ache or pain, and most people pass it off as the normal thing that you'd expect after standing all day. Occasionally people get cramp at night in bed. And the warning sign for me is when your skin becomes itchy or sore. That's often a sign that you're progressing beyond just simple varicose veins and they're becoming a little bit more troublesome. Often people come to me when their legs are swollen, and when I ask, it's usually when they start blood pressure medication. So quite often, certain blood pressure tablets, they work by relaxing your blood vessels. And if you already have a varicose vein, well, then the vein dilates even more. So sometimes you get even more swelling. And veins are nearly always worse in the summer because your veins dilate to help you lose a little bit of heat. And that's why August and September are often our busiest months. You would think with varicose veins that if they were cosmetic, it should be January because everyone has a New Year's resolution to get everything fixed. But actually, January, February are often quite quiet because your veins are a little bit constricted because of the cold and tend not to give you quite as much grief. I was going to talk a little bit about grades of veins because that's often mentioned in GP letters. Grade 1 veins are essentially thread veins, and we can treat those with sclerotherapy. That's a little injection. Works well eventually. Thread veins are quite difficult to treat, which is why many people don't treat them. We often inject a chemical called fibrovein. It will eventually get rid of veins by damaging them. But of course, once you damage the vein, your skin needs to essentially dissolve that vein. So it often takes multiple treatments, and your leg can be quite bruised. So it can take a month or even many months for your legs to look acceptable. So it's not a quick fix treatment. We often tell you that if you come for treatments of thread veins. Grade 2 veins, you can kind of feel them, but again, they're not dangerous. You often see these on people's lower leg. They only become a problem if they're attached to a larger vein underneath. And often people who are on blood thinners can have quite significant bleeds from what look like little tiny veins, but in fact they've got a slightly larger one under the surface which they can't see. Grade 3 veins are where they really start to give you a bit of grief. They often bulge up onto the skin, can become painful, or quite often, and I think many people have seen varicose veins that are enormous, usually on older blokes, and they give them no trouble, and indeed they're not dangerous. So these kind of veins, if they're giving you ache or pain, you can certainly have them treated, but you could leave them alone if they're not causing you any trouble. Grade 4 is where they start to give you problems with your skin, and that can be eczema, itching, soreness, a little bit of redness, but the itching is what I look for, particularly at the end of the day, and particularly in warmer situations. And then When you get on to grade 5 and grade 6, they're often the scary bits of veins where people can develop ulcers or quite serious bleeds. I have to say it's pretty rare. And ulcers really are rare in people who realize that their skin is sore because of a varicose vein. Quite often people who develop an ulcer have had trouble with their leg for quite some time. They often have eczema, itching, the skin is a bit red, and they get various creams and various steroid creams, and they're back and forth to their doctor. And they sometimes don't have any huge varicose veins nearby, so the diagnosis is essentially missed. And then what happens is some years down the line, they bang their leg, or their grandchild kicks their ankle, and all of a sudden the skin breaks and it just fails to heal. So what would have been a really tiny, minimal little injury a few years before becomes a major problem. I'll quickly go through these. So they're a bit grim, but that's kind of what a vein ulcer looks like. I won't stay on that. But essentially, vein ulcers, once you get them, I consider to be a failure of medical treatment. It's a misdiagnosis, can always be treated long before you ever get to that stage. And it is very rare for people who've had their veins properly treated to ever end up with an ulcer. Indeed, sometimes people who do have an ulcer do have a varicose vein nearby, and we treat that, and it does seem to speed recovery up. But I have to say, it is like watching paint dry as you wait for them to heal. And although surgery does help speed up that healing process, it still takes some months to get your leg back to being reasonable. As regards what you do here, if you come to Benenden, you see me in outpatients. So your consultation is with me, and I will do a scan on your leg at the same time. I spend quite a lot of time trying to work out exactly what you want. So some people come because their legs are aching, and I can tell them exactly what needs to be done there. Others want a cosmetic improvement, and I can tell you what you can have there as well. Most times people afterwards will book in there and then. Usually we have you an assessment done on the day, because most people, it takes them a while to get here. And so we just treat you as if you're having something done. I tell you everything, write a letter to you, and do a few diagrams, and afterwards the hospital will contact you and see how you feel. So there's no pressure put on you, and I'm very keen that people know exactly what they're having done, and that we're both fairly certain what exactly you want at the end of treatment. Most people, surgery is done as a day case, and most of it's done under local anaesthetic. I think in general people consider it a bit like a dental appointment. It's certainly not root canal work. And as I say, 95+% will have it under a local anaesthetic, which sounds dramatic, but actually is usually very light-hearted, not too sore, although I do have to give you some injections. So in the olden days, you used to do usually a cut in the groin and disconnect one of those branches of the Christmas tree, and then you stuck a wire down the inside of the vein, and you pulled it out somewhere down the lower part of your leg. And that was an okay operation. From a surgeon's perspective, you were actually treating the problem. From a patient's perspective, it was a bit brutal, a bit grim. But the real problem was that afterwards, as your body healed, it sometimes produced new veins. Those veins weren't normal. And that's why you might have heard stories where people have told you, if you have your veins done, you'd say you'll be forever having them done, or don't have them done before you get pregnant, because they'll just recur and problems will arise for the rest of your life. And that's partially true. About 50% of people who had their veins stripped, even if it was done correctly, get recurrences. And those recurrences can be quite difficult to treat, but they're not untreatable. One of the great things about EVLT or any of those minimally invasive treatments is that they've done away with that essentially done away with the brutality of pulling everything out. Most of the treatments involve sticking something up the inside of the vein, damaging the inside lining of the vein, allowing the vein then to shrivel up, and then letting your body dissolve away the vein. It is amazing how that happens. In terms of how you do it, this is the inside of what looks like a lady's right leg. So up at the top of the slide is the near the groin, and you have a big red artery sending all the blood down and a big blue vein sending all the blood back up again. And the normal vein that causes people trouble runs from your groin down to your knee. And so we thread a little laser up the inside of that vein. We would normally do a few injections to cover it in a tunnel of local anesthetic so you don't feel anything when I'm lasering the vein, which is just a fancy way of burning things. We use a scanner all the time to make sure we're in the right place. And the reason it took us so long to get this up and running, from first seeing it in 2000 to actually getting it working all the time in 2005, was because we needed to work out exactly what power settings to use and also to make sure it was safe. And it's turned out to be a very safe and effective way of treating them. So when you look at treatment options available to you, it can sometimes be very confusing. If I tell you that the NICE, which is the government-funded agency that tells you what's a reasonable treatment, and there is an entire website dedicated to everything, I would say that NICE says that the best way of treating veins is with heat treatment. So heat can be as a laser or electricity, which they call radio frequency ablation, or you can use microwave machines. They all work equally well. I just happen to use a laser because I've used it for many years and I'm quite happy with it. There are other techniques where you inject a chemical into the vein. Sometimes you add a little bit of air, and that becomes stuff called foam sclerotherapy, which I think works very well for smaller veins. I prefer to use a laser for the larger veins, but other people use foam. The biggest disadvantage with foam is that it does produce quite a lot of brown discoloration, and that can be a little upsetting from a cosmetic point of view afterwards. And the latter few, there's a machine called Claravane, which I did use many years ago, which seemed great, but I found it had a higher recurrence rate. But again, other people think it's fantastic. And then there has been recently people have been using a type of super glue to glue the inside of the vein, which I don't use, as I'm a little concerned about injecting chemicals that that stay inside your vein. So appearances after you have your veins lasered, well, clearly we've taken an easy one here. So on the left, a few little bubbly bits on the inside of the leg. That's the inside of the left leg. There was a vein running the whole way up to the groin that was actually causing this, but you couldn't see it. So we popped a laser in that, laser the vein, and a few weeks later you notice that everything deflates, so you can't really see that much. If that was a hairy bloke leg, you probably wouldn't need to do much more. But 6 weeks afterwards, it's usually gone, but there are always a few bits remaining. So occasionally people who want no visible veins afterwards, we would do a few small extra little nicks in the skin just to get rid of those veins completely. So just to remember, that's a good outcome. Go back a little bit. Yeah, and if you look at that, before and after in 6 weeks or so, the thing to remember is that when you have treatment, everyone talks about minimally invasive treatment and pain-free, and it was wonderful. And anyone who ever talks about it says it was fabulous. I would say that people coming in for a varicose vein operation under my care think they're coming in for a bit of a bad day at the dentist. Everyone is a little bit stressed and a little worried that it's going to be painful. I find afterwards they're usually extremely relaxed because it's not half as bad as they thought it was going to be. They're usually in a bandage and relieved that everything is over. So they go home, and if they fill in some satisfaction forms, they are, elated almost that it hasn't been too painful. But I would say it takes a few weeks to get over your varicose vein operation. So although you hear people talk about lunchtime surgery and walking in, walking out, and everything being perfect, I think it feels like you've just done, for men, I usually say it's like the first football match of the year. For girls, I say it's just like the first heavy gym workout. The next day, it feels a bit stiff and achy. Most people will take some kind of painkiller, whether that's paracetamol or ibuprofen. And I think most people would, for example, walk the dog and do their normal things the next day. But I think you'd struggle a little bit if you were hopping on a train to go to central London and whizzing around tube lines, etc. Remembering you have a bandage on your leg, it does restrict you a little bit. And I do feel that it's more or less like a pulled hamstring for the first few days. I think the second week is much better, although you certainly still know that I've done something to you. And I think it takes 2 weeks before you get up in the morning and forget that I ever did anything to you. I think that discomfort is gone at that stage. And then when you look down, you still will probably have some bruising. Most people afterwards can fly whenever they like. I think there's a myth that flying is associated with deep vein thrombosis. It's not really. The risk is quite tiny. People who have an operation can head off wherever they like. I would just say that I know it's 1 mile from the car park to the gate in Gatwick, because I measured it myself. And if you just had an operation, that's quite a long mile, dragging bags, etc. So for most people, I say give it a couple of weeks before you go on holiday. It takes about 3 weeks to pass it off as a normal leg if you wanted to go swimming in a normal pool. And if you wanted nobody to pass a comment when you're away, I think it takes about 6 weeks for everything to settle down completely. So I think next we're going to go on to a little video just to one of our patients.
My name is Jo Crossy. I'm 58 years old. Well, it was making my legs more uncomfortable as the years went on, feeling very heavy and tired, especially in the hot weather. My feet would swell, and just generally feeling achy most of the time. I did start working part-time, and part of that reason was probably unconsciously thinking, actually, I can't keep on my feet all day long, every day. We thought it was worth the drive to go, and especially when it was a beautifully new hospital. It was a very pleasant experience, and I wouldn't hesitate to go back again if I needed to in the future. My GP referred me on the 22nd of January, and I had my consultation with Benenden on the 31st of January, so I was quite impressed by that. The operation was very straightforward. You are given a booklet to explain what the procedure is. Mr Challoner, who I saw, also talked me through it, but obviously when you're in consultation it's a lot of information to take in. So I came home and read the leaflet. I also looked online for him, and he did a very good explanation online. Everything that was in the booklet is exactly what happened on the day. You were talked through it, and the staff were very helpful, supportive, and talked you through every process. I felt as if walking into a lovely environment like that everything was going to be okay, that it would be state-of-the-art technology and processes, so I felt very confident that I was in good hands. My recovery was, again, like it said on the tin, you know, I had to wear my bandages for 5 days and then take those off. I couldn't drive for 5 days, obviously, because they say for insurance purposes. If I had to stop quickly or if I was in an accident, insurance might not be so happy if I was wearing bandages. And then I was back to work in a week. It was a bit achy and a bit sore, but they give you advice about putting your feet up whenever you can, putting in local anaesthetics, rubbing in local anaesthetic gels, wearing a support bandage if I needed to. And I did that a few times because the weather was quite warm post surgery, so I made use of those devices and advice, and it certainly helped. My life now has changed in that I'm not feeling the heaviness in my legs, and I have been wearing shorts out and about, which I hadn't done before, so it certainly boosted my confidence in terms of that. And yes, getting back to running after 2 grandchildren. If anybody was thinking about having their varicose veins done, I would recommend the Benenden Hospital. Their technology and the processes they do it's just a laser treatment is the way forward in terms of not making you lie in a bed, getting you up and getting you mobile. Certainly Benenden Hospital is highly recommended as far as I'm concerned.
I think that's it. Yeah. Thank you. Thanks for that interesting presentation. We're going to take some questions now. So first we have got a question from Hugh, and Hugh asks, can leaving veins untreated result in further damage to other veins?
Not really. So if you have varicose veins, they can sometimes damage your skin, but they rarely cause trouble to other veins. Sometimes, however, when veins get a little bit too big, they can sometimes clot off, and that's a condition called thrombophlebitis. Phlebitis is inflamed veins. Thrombophlebitis is where you get a little bit of clot forming. That can sometimes extend a little, and so occasionally people who have thrombophlebitis can go on to develop a deep vein thrombosis. So if you remember the tree analogy, if one of the branches starts clotting off, it can sometimes head right to the main vein. However, that's unusual. So for most people, I would say if you have varicose veins, no matter how big they are, if they're not giving you any grief, you're not itchy, they're unlikely to cause you too much trouble. They probably will get a little bit bigger. Someone might tell you to wear a compression stocking. Nobody ever wears compression stockings because they're either too tight or too loose or too difficult to put on or too hot. I think they work maybe for a day. So in terms of do they cause trouble for other veins? Not really. They just get a little bit bigger with time.
Okay, thank you, Hugh. I hope that answered your question. The next one is from an anonymous attendee. They asked, do varicose veins risk blood clots?
Again, kind of, but not much actually. So you might say to me, if you've a varicose vein that's not painful, what's my risk of getting a DVT? DVT is a deep vein thrombosis. If you listened or read some stuff, you'd swear you're waiting to have one. And I would say it's about 1 per 1,000 people per year. You might also ask, if you did an operation on me, what's my risk of getting a DVT? Well, it's actually 1 in 1,000. Once medics start talking about 1 in 1,000, they just mean not that common. And 1 in 1,000 to a medic is very, very uncommon. So I don't think varicose veins on their own cause DVTs, and operating them can occasionally produce them. But if you're just an ordinary member of the public, your risk of a DVT per year is actually 1 in 1,000.
Okay, thank you. I hope that's put your mind at ease. And next up, we've got a comment, a question about ankle fractures. So is it common to have problems with varicose veins after an ankle fracture?
It can be. So ankle fractures on their own won't cause you any trouble with your varicose vein, but some, depending on how bad the fracture is. So fracture and a broken bone are the same thing. If you break your ankle, it can be just a little minor crack, or you can really go to 90 degrees. And in that case, it often damages not only the bone, but also the surrounding muscle and veins. So people can often get varicose veins appearing after an ankle fracture. And the last bit is ankle fractures immobilize your joints usually. And the problem with that is that increases your risk of a DVT. So many bone fractures have a risk of a deep vein thrombosis of 1 in 10 or 1 in 20. It's remarkably high. So sometimes after a bone fracture, you can end up with a DVT, and that sometimes shows itself by your veins being a bit more visible in the lower part of your leg.
Thank you. And next up, how do you treat the vein in the groin?
So if I tell you the normal vein runs from the groin down to your knee, I thread the laser in from your knee, wangle it up the inside of that vein right up to the groin. I use a little scanner. And then that scanner, I can see how close it is to the main vein. That is essentially the trick with laser treatment, that you don't want to damage the main vein, which I've never done, but you laser as close to that join as you can. So that's how you treat the groin vein. Sometimes there are different types of groin veins, so there can be some smaller veins around your groin or different veins, and they're occasionally treated with foam. Or even a little tiny incision, and to break them up, called a phlebectomy.
Thank you very much. That made sense. Patricia asks, how soon after a limb angioplasty can I have EVLT?
It depends what the angioplasty was for. So if it was because you're not able to walk very well, I would give that about 6 weeks or so, because an angioplasty is where you stick a balloon inside an artery, usually, can be a vein, and you essentially squeeze open the blood vessel. That's quite traumatic, and I think it takes about 6 weeks for your blood vessel to be in reasonable shape to have anything else done. So I would I would wait quite a few weeks. I wouldn't have it done straight away after that.
Thank you. I hope that's helpful. Next question is from Sarah. Sarah asks, can you treat patients who are on statins?
Yes is the answer. Everyone seems to be on statins. I don't think it makes any difference. It's almost normal. I'm not sure how fabulous they are, but whatever. Everyone's on them, and you definitely don't need to stop them. And that's an interest. An add-on to that would be, if, for example, you're on a blood thinner such as a Pixaban or rivaroxaban, we don't stop those drugs either. You just we can treat your veins even when you're taking those type of tablets.
Next one is, how much walking exercise does one have to do after the op? Walking's difficult for some people due to other issues.
Yeah, so I say once you're out of bed, you're fine. It's remarkable how much your blood flow increases just by moving around the house. So in the olden days, they used to tell people to walk 5 miles a day. That was basically because they thought nobody would walk that far, but they might walk a mile. And I would say to that, you probably don't need to do that. Most people, once you're out of bed, walking around the house, you're fine. Anyone who has a 2 or a 3-year-old gets more than enough exercise in the house with those. So I would say you don't have to actively go out of the house and walk around the neighborhood. Once you're up and out of bed, that is the key. The most important thing is that you're out of bed after the operation, because once you walk, your blood flow increases dramatically, and that saves you from problems such as DVTs, or and actually speeds up your recovery dramatically.
Okay, that's great. So keep moving is the answer there, I think. Anonymous attendee has asked, do you treat the cause or the symptoms only?
That's the whole point of the initial consultation with me. That's for me to work out what's wrong with you, because if you come to me with cramping or ache, I want to make sure that the vein that you have fits the symptoms that you have. So if you have cramping, aching, itchy skin, I want to make sure that if I do an operation on you, you'll be very happy and everything will have go away. And likewise, if people come because of cosmetic issues, I like to make sure that I don't just do the most superficial veins that will almost certainly recur if there's another varicose vein line underneath. So I'm very keen to scan people and tell them if the veins they see on the surface are actually caused by another vein, and that you have to have that one treated to get any reasonable result. So the whole idea is that from a cosmetic point of view, you need to be happy with me, and I tell you time scales, etc. for that. And for the other group, there's often quite a big crossover, but the other group who have achy, sore legs, I just want to make sure you don't have achy, sore legs a few weeks after I treat you, and indeed you spend your good money on an operation.
Okay, thank you. Anna says that she's got peripheral neuropathy in her feet and legs. Would the laser treatment exacerbate this condition?
It doesn't usually make any difference to that. Quite a lot of people have diabetes and with some peripheral neuropathies, and we would treat them. So I would not be treating the varicose vein is not going to make any positive difference to your any peripheral neuropathy. So it would just be a by the by, so to speak. I would be treating something else. So whether it's ache, pain, or discomfort, but I wouldn't necessarily make any real difference to your peripheral neuropathy one way or the other.
Okay, thank you. That was helpful, Anna. Jacques has asked, how successful is treatment if the skin is already discoloured from varicose veins?
Well, if your skin's already discolored, that means your skin has been damaged. So that when you get brown marks, it's a type of scarring. If you have a varicose vein nearby, treating the varicose vein is only going to help prevent further progression of that scarring. It rarely gets your skin back to normal. If it's just a little bit red and itchy, yes, that should go back to being completely normal. But if for whatever reason your skin is quite scarred and brown or hard, your cosmetic result will not be as good. But I would say that if your skin is like that and you have a varicose vein nearby, it will certainly progress further, and that's one of the warning signs that you could end up with an ulcer. So discoloration of your skin wouldn't stop me treating it. It would actually push me to treat you. But sometimes you can't get back to where you started before you had varicose veins in the first place.
Okay, thank you, Jack. I hope that is okay for you. Next up is from Bridget, and Bridget asks how many veins can you at one time in her case that she's got lost.
Depends what they are. If you're thread veins, well, there's a limit on how much stuff, chemical I can give you in one go. I try to do as much as I can, but there is a definite limit on that. And with regards to varicose veins, well, interestingly, often the varicose vein, say for example coming from your groin down the inside of your leg, has multiple branches, and quite often you just treat the main vein that's causing trouble and all the other side branches deflate away. So you often don't have to do quite as much as you think from a varicose vein point of view. From a thread vein or those cosmetic small blue veins, you do have to treat all of those. That's why that takes takes many treatment episodes to get it looking good.
Okay, thank you. Frances asks, she's on blood thinning medication. Would she need to stop that medication at some point before?
Yeah, no is the usual answer. So almost everyone who has a varicose vein operation has a blood thinner on the day. That's to allow you to get home from the hospital and gives you a 24-hour period where your blood is a little bit thin, and that's to try and reduce the risk of a DVT. Sometimes people who were previously on drugs such as warfarin or Pixaban, they would have to stop it for a variable length of time beforehand, and I couldn't really see the point in that because we anticoagulate everyone. So for some years now, I have not stopped Pixaban or warfarin for most people, and we just get on and treat them. You bruise a little bit more than perhaps someone who's not on a Pixaban, but it seems to make no real difference, and it doesn't seem to increase the risk of bleeding. When I'm doing veins, you're always going to bleed. So the whole idea afterwards is that I send you home not bleeding. So it doesn't really matter whether you're on a Pixaban or I've given you a blood thinner. Either way, I try my best to make sure that you're not, there's no spots on your dressings when you leave the hospital.
Okay, thank you. Somebody's asked, can varicose veins affect your overall circulation?
Yeah, again, kind of. So if you've got a whole lot of blood sitting in these veins, normally they don't give you much grief in the morning, and as the day goes on they fill up, and then you go to bed at night or you lie down at night, and all that old blood essentially seeps back into your muscle, which is why you get a bit of cramp and your legs feel like they're on fire, or they can feel a little bit restless. But when you're actually exercising, your veins, the blood in your veins are essentially siphoned up your leg. So surprisingly, exercise doesn't usually make veins more painful. For most people, there's always exceptions to that. So varicose veins don't really, they're not particularly bad for your circulation as such. The problem is how your skin reacts. So if by having blood pooling on your lower part of your leg, your skin is unhappy, well, that is bad for you because your skin will become darker in color and may well become itchy or even ulcerate. But for most people with varicose veins, it doesn't really make that much difference. Once you're walking around and doing your stuff, your circulation is essentially normal.
Okay, thank you. Celia's asked, is peripheral vascular disease an outcome of problem veins?
No, they're two different things. So peripheral vascular disease or peripheral arterial disease, sometimes called PAD, is where the blood going down to the muscles in your leg is just not getting there easily enough. The main arteries going down your leg are rather like motorways, and peripheral artery disease is like roadworks. It can sometimes block the blood vessel completely or sometimes narrow it, and it's okay at sort of quiet times. But the moment it gets to rush hour, when you're walking fast, for example, the blood just cannot get through these blockages. So that's completely different from veins, which are basically, after all the blood has been delivered, veins take it back up again. So they're not, they're not involved in the inflow of blood into your leg. Varicose veins are kind of, think of it as a slow outflow from your legs.
Thank you. Just a couple more questions left. Somebody's asked if I'm on blood pressure tablets and have EVLT, will the veins come back?
EVLT is pretty good. So it depends how you answer that question. So for most people, I tell them that your risk of a vein returning within a year is around about 1%. Some people will tell you that once you laser a vein, it's gone, so your recurrence rate's 0. What most people are asking is, if I have my veins treated, when are they ever going to come back? Well, for most people, they don't. I tell people around 10% of people will have another trip to a vascular surgeon at some stage in their life. It's nearly always for a vein on the other leg. But so they don't necessarily recur. But if you've had varicose veins once, you're a little bit more likely to get them again. The important thing there is is how you answer the question as to whether veins recur or not. If you're on if you're having, for example, if you've got a blood pressure medication, or even if you have very large varicose veins, treating them with a laser should get rid of that vein completely. That's the whole point of having the treatment. So I would say that if you come to me with a vein, I should get rid of it for you, and you shouldn't be back to see me anytime soon.
Okay, that's good to hear. Jacqueline's asked, can you have surgery on varicose veins in the lower leg that also has erythema nodosum, permanent bruising?
Yes, you can. Yeah.
Right. Can taking away the damaged veins leave you with less veins, causing problems as you get older?
No, not really is the answer to that. So the most important thing is, if, again, think of the Christmas tree. If the main vein is perfect, you're fine. You have hundreds of veins. Most of the muscle veins are draining quite large quantities when you're exercising. The skin veins are miserable little things, but you have loads of them. Most of them are smaller than the size of a shoelace, and they drain about a teaspoon of blood. When you see a varicose vein, it is one of those veins, so those miserable little shoelaces, not working. They become large, and you think, well, actually, that's quite a large vein. Surely I need it. And I would say to you that that vein is not working correctly. That blood is just pooling there. In fact, quite often it's not just pooling, it's actually flowing in the opposite direction. So the reason you're getting symptoms is it's overwhelming all the other little tiny shoelaces that are trying their best to get blood uphill. So when you remove that vein, you're often given the rest of your veins in your skin a holiday, because they suddenly only have to do their own job, and they don't have to take care of that waterfall that's falling down from your groin. So sometimes people say, oh, well, if you get rid of one vein, will that put more pressure on the others? The answer to that is definitely no. You get rid of a varicose vein, the rest have a little holiday. That's why your legs feel better afterwards.
That's good to hear. Bernice asks, do you need to be accompanied for this treatment?
Not really. I would say to you, though, it does feel a bit, it's a bit stressful. So it is lovely if you have someone to give you a lift home afterwards. Plenty of people get a taxi to the train station and head home. There's no particular medical contraindication to that. I would just say that it does feel a bit stressful. You're usually relieved afterwards that it's not quite as bad as you thought it was going to be. But I would say the ideal would be that someone gives you a lift home afterwards. It's just because you do feel a bit stressed out.
Okay. And our final question this evening is there a genetic predisposition to varicose veins?
It depends which parent you love. So I would say, yes, you can get them from your parents. Most people don't. You might say, why do girls get them more than guys? And that's actually your hormones. Sadly, you've got a hormone called progesterone, which goes really high just before you deliver a baby, or just before you have a period. And that hormone is kind of designed to relax everything to allow baby to pop out, but it relaxes veins as well. That's why girls get veins a little bit quicker than blokes. But so genetically, well, if you're a girl, you're a bit more likely to have troublesome veins, although blokes get them a little bit older. Very occasionally, I see people who are age 13 with varicose veins. That's definitely genetic. But for most people, I think it's just a bit of bad luck, hormones, standing, and life. Most girls don't get any varicose veins in their 20s. I think it's usually when you're in your 30s that you start to notice veins, but that's normally when you have a few kids and you're a bit exhausted from that and don't have any time to look after yourself. The commonest age group of people having varicose vein treatment is actually 40s or 50s. You'd be surprised. Everyone thinks it's 18-year-olds making sure that everything looks good. I would say the commonest group are much, much older, and have had their veins for many, many years, but have had other life issues and just haven't had enough time for themselves.
Thank you. So I'm afraid that's all the questions we've got time for. I'm sorry if we didn't answer any of yours. If you wouldn't mind going to the next slide, Mr Sweeney, please. Thank you, lovely. So as a thank you for joining the session tonight, we are offering 50% off the value of your initial consultation. Call back from your dedicated private patient advisor, an email tomorrow with a recording of this session and further information and updates on news and future events at the hospital. We'd be really grateful if you could complete the survey at the end of this session to help us shape future events as well. If you'd like to discuss or book your consultation, our private patient team can take your call until 8 p.m. this evening, or between 8 a.m. and 6 p.m. Monday to Friday, using the number on the screen. You can also book your consultation on our website with the discount code VEINS50. A link to book will appear after you've submitted your survey response. Our next webinar is on hip replacement surgery, and you can sign up to this via our website. So on behalf of Mr Sweeney and our expert team here at Benenden Hospital, I'd like to say thank you very much for joining us today, and we hope to hear from you very soon. Thank you and goodbye.